said, we'd be back with the team, and we're here to talk a little bit about what we talked about this morning. And I just want to go over everything you told me, the history of Dan's illness, and just stop me at any point if you feel that anything I said is incorrect, or if you have any questions. And I'm going to sit next to you so I have to be on eye level with you, okay? And Dan. Alrighty, so, and I have my team here, so I'll be telling both of them and you what's happening. So we have Dan, who's a 12-year-old male. He presented with a rash that he had for the past 3 hours. He was playing football at the time when he noticed red blotchy, slightly itchy spots on his right forearm, which after 20 minutes he stated was both on his trunk and his arms and legs. He reports that 5 minutes prior to the initial onset, he had been hit by a football on the same right forearm where the rash was seen. And he's not sure if there were any insects around where he was playing. The backyard of his house has elm trees, birch, grass, flowers, but he actually was playing in the front yard. And his mom notes that last spring, for about 2 weeks, he had some puffy red eyes that resolved on its own. The lunch that he had prior to playing football outside was almond butter and jelly. He hasn't used any new lotions, new detergents, new soaps, or new shampoos. And 2 days ago, he returned from a camping trip with his dad where he did experience a bunch of bug bites. And 2 months ago, just a little additional pertinent information, he went on a class trip to rural Nicaragua. Also, he does have one sick contact, which is his brother in the house, who has had a little bit of a stomach bug for the last 3 days. His past medical history is significant for asthma that was diagnosed when he was 6. He's had 2 hospitalizations for that, and that happened in the last 2 years, and he has eczema. His appendix was taken out when he was 10, and he's currently on loratadine, 5 milligrams, and albuterol is needed for his asthma. And as for allergies, Mom reports that initially you were telling me that he had never been diagnosed with allergies, but upon further discussion, there's questionable seasonal allergy going on, as well as allergy to strawberries, which causes itching and tongue swelling. His immunizations are all up to date. And family history, Mom has rheumatoid arthritis, and Dad and his older brother has seasonal allergies and asthma, and his brother has a peanut allergy, and as stated, a stomach bug for the last couple of days. Social history started 6th grade back in the fall, and he lives with his mom, dad, brother, and granddad, who just moved in about a month ago from El Salvador. On review of systems, in general, Mom reported that he was warmer than usual by touch last night before bed, and he has a general achy feeling, and he appears more tired than usual. As for, he hasn't had any eye discharge, no pain, no sore throat, and no fatigue really, a little bit of tiredness, but no fatigue when running or when playing, and he hasn't fainted. He hasn't really, no respiratory distress and no wheezing that he's reporting, and no diarrhea, but he did vomit earlier today while he was at the ER. He hasn't had any unusual bruising or bleeding, and he hasn't had any difficulty walking or joint pain, but he does have this diffuse rash on his extremities and chest and back. As for his physical exam, he doesn't have a fever. He's at 37.1 Celsius. His heart rate is a little elevated at 120. Respiratory rate's 20, and his blood pressure is 90/44. When I visited earlier this morning, he was sitting quietly, but he was scratching his arms and legs. There was nothing particularly remarkable. His posterior oropharynx shows some cobblestoning, but no lip swelling, no tongue swelling, no problem on swallowing, and his voice sounds normal. As for that, there were some inspiratory wheezing that scattered that were oscillated bilaterally, but no nasal flaring and no difficulty, no tripoding. His abdomen soft, non-tender, normal bowel sounds. His skin does show multiple redness, small, between sort of 2 centimeters to 6 centimeter round spots that are kind of on top of each other in some places. And range of motion is good, joint strength is 5 out of 5, and the labs have yet to come in, we haven't gotten them in yet. And so we have our 12-year-old male who's presented with a diffuse rash, and so what I'm thinking after meeting with you this morning is that we call it acute urticaria, which is kind of a fancy word of just saying hives, which you stated he'd never had before, and there could be multiple reasons that he's experiencing hives, especially hives can be caused by food, it can be caused by an insect bite, by some sort of infectious process, or contact, similar to like poison oak or poison ivy. And given his story, I want to look a little bit more into all these different possibilities of the reason that it's happening. Because the jelly, I don't know if it had strawberries in it, that could have caused it, or the insects, an insect bite, sometimes very special, like yellow jackets could cause it, or when it comes to an infection, if he is just exhibiting the infection his brother has, but in a different way, or if granddad brought something back, or just the pollen of the bushes outside, we don't know, or something from camping. So I really want to look a little further at all the labs that come in that we ordered. And other than that, we'll talk a little bit more about the plan later.